Hi, my name is Maura George. I'm an associate professor in the Department of Medicine in the Division of General Medicine at Grady. And I've been here since 2009 on faculty after finishing my residency. Most of what I do is in the School of Medicine as a small group advisor or doing some curricular course development. And then I do some ethics at Grady and some other things as well. My answer outside of 2020 would be very different than this year. The word for 2020 that I'm borrowing from my child's elementary school principal is grace. I think wellness this year is giving yourself grace and giving grace to others around you. Recognizing that with so much out of our control, the best that we can do is bloom where we're planted, and kind of do the best you can. Living a balanced life to me means feeling a sense of accomplishment at work, cherishing the time that I have with my very quickly growing little boys and making sure that they know I love them beyond anything, being present for family and friends, and doing something to make the world around me a better place in some way. But wellness is a step further than a balanced life because it means there's also some focus on me, who I am as a person, and what I need to be the best that I can be in all of these parts of my life. I think finding a mentor who cares about you as a human being is really key. And I've been really fortunate in the mentorship that I've found. I think being a physician often brings long, unpredictable hours, and in academics, the expectation that you're productive outside of office hours a lot of the time, writing manuscripts or grant applications or fine tuning a lecture. And so finding someone who can really look at your lens, look with a big lens at your life and intertwine your personal and professional life in the advice that they give, I think is so important in being able to achieve that balance. Some of the mentors that I've had, I remember Ira Schwartz and Jada Bussey Jones, who are mentors to me, but also would be responsible for finding coverage for me as I was out. When I told them that I was pregnant, I remember each of them jumped up and hugged me, and just this recognition that they cared so much about me as a person. And I remember Ruth Parker, another mentor of mine, told me once, if at the end of the day you don't have enough left to give your best to the people who mean the most, you're working too hard. And I think that's true. I don't know that I'm achieving that this year. I think sometimes my kids get 10% of me at the end of the day, but I think that finding someone who can help you to navigate that balance, and counseling you on when to say no to things is really important as well. I think you have to recognize that right now, maintaining wellness and balance with work and family life, I mean, these things are mutually exclusive. For me to be a great physician right now or a great academic educator is being on a screen. And to be a parent is not being on a screen in person with your kids. So, I think they're mutually exclusive. You have to do everything often in the same space right now. And a lot of us are working from home for much of the time, and recognizing that that dual role just doesn't work well. And so, um, I think there are days that I feel like I did a great job at work and I was a great physician to my patients, or I was a great mentor to my students. But then I don't feel like I did a great job as a mom. And then there are days that I think, wow, I really rocked it as a mom. I might have missed some emails. I might be behind a little bit, but that's okay. And I think there's not a time when I think I'm at the same exact moment being a great doctor and a great mom. But recognizing that that's just not possible right now, and seeing value in the time that you spend with your family is really important. Recognizing that that quality of time that you are able to spend is often as important, if not more important, than the quantity of time, and really giving your best and being present when you are there.